I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor.
Do you want to hear something crazy? Your doctor doesn't actually have to believe you in order for you to get better. I just want to sit with that for a sec because I'm sure you don't believe me, but I want you to hang with me on this thought because I think that waiting for validation from your practitioner is probably getting in your way of feeling better. And I want to show you that just based on the way we think about problems in especially the conventional medical model, that whether or not your doctor believes you, you probably can still get access to the things that you need. I'm going to share with you how to ask for them. And I'm also going to show you that them not believing in you is not a barrier, actually, and how sometimes we can use that to help us contextualize our own experience, not unvalidate our experience, but just contextualize our experience. So I get asked often on social media, and that's honestly what prompted me to consider this episode. I've been sitting on this question for a while, and I was like, I don't know where to answer this question. I find sometimes in social media, the timing and the amount of video time and whatnot is a limiter. And that really wasn't the right space to talk about this very important concept when the life cycle of some of those posts is very short. And so the people that need to see it may not have actually been able to see it. So we're going to address it here because it gives us a little bit more time and gives me the opportunity for us to have some depth. So what does it mean when your doctor doesn't believe you? And I want you to think back to experiences that maybe you've had, or maybe even experiences that others close to you have had and then shared with you. Anytime we feel that our experience is not believed, it is not validating our feelings. It's not validating our lived experience. And there's lots of spots in our sharing of our personal story where someone, and that someone that we're really talking about today is your health practitioner or someone on your health team, doesn't believe parts of your story or doesn't believe your experience or tries to untie maybe some things you've tied together as part of your experience. So maybe your doctor doesn't believe your symptoms at all, right? You say something that's quite unique about your case. Maybe there's the timing of your symptoms. Maybe there's some cyclical experience of your symptoms, and your doctor discounts some of those pieces about it. Well, that's probably not happening. That's probably not why that's happening. You also may have felt like you figured out some connections or root cause of why you feel the way you feel that your doctor has then discounted. So I haven't felt well since. Those are great sentences that patients use to describe these sort of pivotal moments in their lives where patients have made a connection between an event and how they feel now. And their practitioner says, well, that's not possible. Pregnancy doesn't cause those symptoms. So just because you haven't felt well since pregnancy doesn't tie those two things together. And so they in essence are sharing that they don't believe you. I'm going to say that I think that's just poor communication, but that's how you're going to feel about that. If they say, well, being sick like that can't cause you to feel that way, or breaking your ankle can't cause that kind of long-term experience that you're having. That's in essence them not believing what you feel your experience is, and that can feel very uncomfortable as a patient. And one of the other more common ones is when people have had a negative experience with medication or a negative experience with other treatments and their doctors say they don't believe them. Well, that's not a known side effect of that drug, and so I don't know why you had that. It's implying that we don't believe the patient that that's what their experience has been. Now, we're going to sit in the yucky of this conversation because sometimes your doctor's right. Again, I think that this is often a miscommunication or communication issue. But also, whether or not they believe you shouldn't get in the way of you getting care. So let's start there first, okay? So let's remember the way that we treat things in conventional care is we often are looking at symptom management and disease management and control. Very rarely are we looking at cure. And that's partly because a lot of the things we talk about in health these days are these long-term chronic conditions. We're not often talking as much about infectious disease or self-limiting conditions or conditions where eventually we recover from completely. We're often talking about this long-term health management strategy for patients, whether it's their acne or their hormonal concerns or their infertility. We're often talking about a long-term discussion with patients. And so conventionally, the way that we're often supporting that, and integrative medicine wise as well, is we're talking about symptom management, we're talking about disease management. We're not usually talking about reversal or cure. And that's partly because a lot of these long-term chronic conditions we're discussing do have a genetic component to them. I always say, like, if one more person tells me about a cleanser for my acne, I'm going to punch them in the face because there's an aspect of acne that's genetic, and no matter how great your skincare routine is, you might still get some pimples sometimes. But conventionally, and even in integrative medicine, this is often what your practitioner is trying to do for you, is to support the end stage symptoms, prevent your disease or condition from getting any worse, and trying to manage your day-to-day experience with it. So whether or not they believe that your symptom is from the thing that you think it's from, that doesn't actually change what they're going to give you for it. It 100% changes the way you feel about your interaction with them, but it doesn't actually change what they give you. And so I'm curious whether or not if we can just acknowledge that, right? That if them as a person and they're maybe doing a really poor job at, decreasing their personal bias, at keeping a nice, calm, straight, warm face when they look at you, that they're not letting their, little quips or phrases that they say with patients infect your story. The answer, you probably leave that appointment with the same prescription, the same lab work, the same suggestions, whether or not they believe the connections that you've made in your story or not. And that, in a way, that does feel a little bit yucky, right? Because you want someone to acknowledge your experience. You want there deeply to be some kind of root connection that you get to make, and then somehow by making that connection, it's going to make your treatment better or make us give you something different. But the reality is you probably get the same treatment for your acne, whether we understand the root cause or not. You probably get the same solutions for your hot flashes, whether we believe or don't believe parts of your story. So in a way, that's actually quite positive, because it means no matter how grumpy, how poor the bedside manner is of the person that you're working with, you probably still get the same level of efficacy out of the treatment. It's interesting. My husband and I talk often. We call him a retired dentist. He's a retired dentist who now works exclusively in helping support dental practitioners in the sale and transition of their practices. But we talk often about things like goodwill in a practice and retention of patients. And it's interesting because the surgeon really doesn't have to have very good bedside manner, right? They really don't. You can be like, he was a total asshole, but he really fixed my meniscal tear. And the further we get away from some of those surgical techniques and where we're talking more about chronic disease management and lifestyle management, etc., all of a sudden the bedside manner of the doctor or the way that the doctor talks to you has a way bigger impact on the way you feel about your treatment versus the surgeon, right? So if you thought about your prescription for your HRT or your prescription for your antidepressant or the suggestion, that you're going to do X, Y, and Z for your acne, if you thought about them in terms of the surgery, right? You're leaving the doctor's office with the best case scenario, the absolute best treatment possible. They gave it to you. Whether or not they were an asshole doesn't actually change what's written on the piece of paper. The problem is that in lifestyle medicine especially, but lifestyle medicine, primary care, where your feelings and your behavior and your compliance actually dictates the success of the treatment. If your doctor's an asshole, you don't do it, right? You take it home and you put the cream on twice and you go, well, he was a jerk, so I guess this cream probably doesn't work. But we don't feel that way about the surgery, right? In a weird way, we actually kind of want them to be an asshole, because if they are, it probably means they're damn good at their job. I don't know why we think that, but we do. And so I need you to try, I know it's impossible and hard, but I'm going to ask us anyways, try and separate the way that your doctor perceives your story, separate it from the solutions they give you. Because 9 times out of 10, they're not going to be that different. Now, 100%, I'm sure you've gone to the doctor with a request for some lab work, or you've wanted something investigated because you feel you've made a connection between 2 or 3 things in your life, and now you would like them assessed or investigated, and you've been turned down. This is maybe that one time where their lack of believing in you does change your outcome. I think with prescriptions and with treatment, you're very rarely going to leave with the wrong thing, even if they don't believe you, because the way we're looking at you is symptom-based. We're treating your hot flashes either way. We're treating your depression either way, whether or not we believe that it was triggered by something or that you're having that experience because of such and such reason. You leave with the same prescription. I think where it does start to show up is a little bit in the assessment space, because if your doctor doesn't believe your experience, it may change the suggestions that they give you for assessment. And I think that's why people often are looking for sort of point of care, like patient facing lab tests where they can buy them online, or they seek integrative medicine that is often trying to find, unique and novel ways of testing people. I think that's often why we go down that route, because our doctor didn't really believe us. We feel like it meant that we didn't get a thorough assessment, and now we're going to seek some sort of off the beaten path solution. But for the most part, if we can separate your doctor believing in you and what you get out of the appointment, like what you leave with, they're probably not as connected as you think they're connected, which is fortunate, I guess, but also unfortunate, because healthcare is so much more than that piece of paper that you leave with. And that's probably why we're all here, right? Like, we believe that healthcare is more than that piece of paper that we're leaving with. But yet right now, while you're trying to tackle the most important health challenge that you're facing right now, whether or not your doctor believes you're in perimenopause or not doesn't change what they offer you. If what they offer you doesn't help or isn't the right solution for you, then it may not be because they didn't believe you. It may be because they have limitations in their prescribing. They may have limitations based on their scope. It's not because they don't believe you, right? They checked all the boxes for the way you felt, and then they gave you something for your symptoms. So the other side of this conversation, which is yucky, don't shoot me, is that sometimes patients are wrong. Sometimes patients are wrong about connections they've made. And remember, when you're seeking the support from a professional, that you have your individual personal experience, and your doctor is there to contextualize it against statistics, likelihood ratios, and then of course their experience. And so when you've made a connection between something and your doctor says, I don't think that's the case, here are some other reasons why that may have happened, they're not saying that just to be a jerk, right? They're saying that to try and help you contextualize your personal lived experience against the norms. And you absolutely can not follow the norms. You can be that kind of, we always call them like the unicorn patient, that one person who after they sprained their ankle had perimenopause. Like, you could be that person totally, but your doctor is there to help you contextualize your experience and normalize your experience. And so if you have made a connection and your doctor tries to help you unravel that a bit to say, you know what, maybe it isn't your shift work, maybe it's the lack of sleep. They're not saying that to be mean, right? They're saying that to help you try and contextualize your experience and give you some direction to think about solutions. So I do think that sometimes that, when we say our doctor doesn't believe us, that we're really discounting a lot of aspects of what that role is. Our doctor is there to try and help us differentially diagnose our experience and sort through your symptoms, what you say, what they notice about you, your lab tests, to try and help you find an answer. And I think sometimes when we think that our doctor doesn't believe us, or doctors don't believe patients, or we're talking about practitioners in this really negative light, we're forgetting that they literally went to school so that they can help people have better health. Your doctor went to school to learn how to help people solve their health problems. And when we go to them and they try and help us solve our health problems, sometimes when they say something that's counter to what we think or what we believe, we immediately think that they're not listening. We immediately think they're out to get us. We immediately think there's a bit of a conspiracy, because that actually feels safer, that our doctor is mean, our doctor's not listening, our doctor doesn't care, than it is to unravel the way that we feel about our own health and try and rebuild a new understanding of our health and our experience. Because if you've carried around with you for a long time, the women in my family can't lose weight, or I haven't been well since I had kids. If you've carried those things around with you for a long time and someone says, "Ooh, shoot, actually, that's not true," of course, it's easier to point our finger at them and say, well, they're not listening. They don't know me. They haven't been here all 20 years that I've had to live with this. And yet, they went to school to try and help people sort out these things. So I think we probably need to have some kind of meet in the middle around this, where I think doctors absolutely can use some training and communication. Funnily, my husband, Sean, who I mentioned earlier in the podcast, is actually running a negotiation and communication workshop for clinicians this fall. He's done some incredible work with negotiation courses and other professionals on how to communicate based on what your patient's values are, what their needs are, what their priorities are. And really, doctors don't leave with that, right? They leave being exceptional test takers, exceptional clinicians. And then when they need to use tactical empathy or some of the very active communication strategies to connect with patients, they're a little bit at a loss unless they were just born with good communication skills. And so that the purpose of that is for us to attack this problem from the clinician side and say, like, you can have a very different way of approaching patients, still give them that same piece of paper, the same solutions, the same prescription, but have them feel very differently about the interaction that they've had with you as a clinician, so that we can actually empower them to do the cream or take the tablets or go to the gym and all the things that they hired us to help them curate a plan. And yet our communication strategy is really where things kind of fall flat between us. But I also, for you as a patient, want to invite you to try, like I said, it's hard, but try and not worry so much about whether or not your doctor believes your experience, and just think about what you need to get out of the experience with them and what their limitations are for being able to support you. If you're looking for emotional validation about your chronic condition, you might not be able to get that from your primary care physician in a 7-minute appointment, just saying. And so instead of getting frustrated at the human, let's try and get better support or different support, or acknowledge the kind of support that we need, which may be more psychological than anything. And also just use those healthcare appointments for what the scope of them actually is able to do. And I really, really believe that your doctor doesn't need to believe you for you to be offered 90% of what you need to feel better. That last 10% that, where they're kind of arguing with you is getting in the way of your progress, we just need to look elsewhere for support, or look elsewhere to get that validation or assessment or whatever it is you feel like you need. But I don't want you to go into your primary care appointments with this chip on your shoulder that because your doctor doesn't believe your lived experience that you can't get what you need out of your appointments with them, because I think you can. They don't need to believe you to offer you the birth control pill or an IUD. They don't. But also, I want to invite you to consider what they say. When someone doesn't believe what you think about your own health, it's not because they're trying to hurt you. It's because they're trying to explore possibilities with you. And if that feels uncomfortable and yucky, I want you to really consider the relationship that you have with your symptoms. Because what would be possible for you if they went away? What would be possible if you were wrong about why they're there and someone could help you sort through that? What would be possible for you? When I opened my clinic way back when dinosaurs roamed the earth, my tagline was, at the time, because I really wanted people to my tagline was, be open to the possibility of change. And it's because I really felt like what my role was to help people with their mindset around change and looking within and looking deep at the role that their symptoms were serving in their life, what they could possibly get from their lives if we thought about their condition differently, if we supported them differently, how patients needed to support themselves and truly get out of their own way to become better. I just wanted people to engage with healthcare with this hope and possibility that things can be different. But in a way, that doesn't just start with our doctors being open to the possibility of change. It also starts with us as patients, as users of the healthcare system. So while I don't think you need to get at least 4 or 5 steps into a health plan when your doctor doesn't believe you, I also want you to consider your health from a different perspective and remember that everyone is here to help you. And let's try that on for the fall and see how that feels and if it does anything different for the way that you experience your health. See you next week.
I hope you enjoyed that episode of Women's Health Unplugged. We're changing things in women's health. One episode, one topic, one conversation at a time. I want you to feel confident in your health. Please remember that the podcast does not constitute a medical relationship or medical advice. Please talk to your family doctor, your practitioner, your specialist, or anyone on your health team if you think some of the topics we discussed in today's episode apply to you. Take care of yourself. Until next time.